Hi, welcome to my channel. I'm Dr. Arti Thangudu. I am a diabetes, thyroid, and hormone specialist. I focus on lifestyle optimization to prevent, reverse, and treat chronic diseases and to reduce the burden of medications. However, sometimes medications are needed, and I think it's important for people to know about those too. Before we get started, please don't forget to like, share, comment, and subscribe to help me get the message out. If you're new here, please check out my videos on insulin resistance and what we can do to improve insulin resistance from a lifestyle perspective. Today, I'm going to shift gears and talk about medications. Medications are very helpful for some patients, and I think it's important for patients with diabetes or people who have family members with diabetes to know about medications. And also, we don't have to be afraid of medications. We have a toolbox that contains multiple different things. It contains lifestyle, diet, exercise, sleep, those types of things, but we also have medications at our disposal, and if we can use them safely, they can be very effective for reducing the burden of disease. So I'm going to start by talking about metformin. Metformin is an older drug that we still use for diabetes today. It came to the market in the United States around 1995, so it's been available for about 25 years. Lots and lots of patients are on it, and it is very inexpensive. So if we can use it safely, it is still a good option. Metformin is part of a drug class called biguanides. It's the only medication of this class available in the United States. The full mechanism of action for metformin is still actually unknown. However, it works most on improving insulin sensitivity at the liver. As we discussed in my insulin resistance video, the liver produces sugar. Insulin tells the liver to stop producing sugar when we have enough in our bloodstream, like when we eat something. Now, when the liver becomes insulin resistant, that insulin doesn't work as well to tell the liver to stop making sugar. So the liver in diabetes makes sugar when the blood sugar is already high. We don't want this. So metformin improves liver insulin sensitivity. It helps the insulin in your body communicate with the liver to stop making sugar when we don't need it. In my opinion, this is great. We want this to happen. A lot of people get nervous about metformin because they have heard that metformin causes kidney problems. Well, that's not true. If you have existing kidney problems, metformin can make those problems worse, and so you should discuss with your doctor how your kidneys are functioning before you start metformin. If you have impaired kidney function, perhaps the dose needs to be lower, or you shouldn't start it at all. But metformin itself does not cause kidney damage. The most common side effects of metformin are gastrointestinal problems, most commonly bloating and diarrhea. Not everybody gets these, but they are pretty common. We attempt to reduce the risk of these side effects by slowly up-titrating metformin to the max tolerated dose. Oftentimes these side effects are short-lived, and after being on the medication for some time, they resolve or improve. Some people, though, are unable to tolerate metformin, and it's okay if that happens. We can simply stop the medication, and typically the side effects resolve pretty quickly. The most feared and rare complication of metformin is something called lactic acidosis. This is a potentially life-threatening complication that rarely happens. While it is really frightening, it is exceedingly rare. It usually happens in patients who already have some other predisposition for lactic acidosis. So definitely talk to your doctor about your risks or potential risks with metformin. Your concerns are valid, but I'm here to say that metformin, for most patients who have had the appropriate medical screening prior to initiating metformin, it is generally safe. Also, many people tolerate it just fine. So I still use this medication in my diabetes toolbox, and a lot of patients have good results. The average A1C reduction with metformin alone is somewhere between 1 and 2%. Now that coupled with diet, exercise, and perhaps some other medications can be much greater. If you have any questions about metformin, please don't hesitate to ask. And again, please don't forget to like, share, comment, and subscribe Thanks so much for listening. I hope you learned something today, and see you next time.